All right, it looks like we have enough people in the room now, so I think we can get started. Um, Make sure the camera is pointing in the right direction. Okay, so I'm Dr. James Costanzo. I'm with Premier Orthopaedics. Specifically, I work out of the Glen Mills, Media, Wilmington, St. Francis, and Aston offices. As you can see, though, today I am working from home, and we're trying to do as much of that as possible right now, obviously to keep everybody safe and still keep everyone cared for with their orthopedic and musculoskeletal problems. And that's why we're here to talk about this today. We're here to talk about telemedicine or virtual medicine. And this is a new thing to a lot of us, both patients and physicians, but we're having a great response so far, and we are making changes on the move to make sure that we have uh, as good of a response and experience as possible for all of our patients. Obviously, the big push for this right now, and the reason that we are really doing so much more telemedicine than we were previously, is because of the unfortunate coronavirus outbreak that has been going on. And this has been, just a part of our response as far as keeping everyone safe at this time. And that response, like I said, is not just about telemedicine. It's about having fewer patients in our offices, making sure that staff and physicians are limited to one office rather than traveling around and having more exposures, to keep those exposures for our patients, our staff, our physicians to a minimum. We're also making sure to have frequent and thorough cleaning of our offices, of our exam rooms, our waiting rooms. We're making sure to keep fewer patients in the office at one time, fewer patients in the waiting room. And we're doing that by, again, scheduling fewer patients in the office, by putting patients into an exam room almost immediately upon arriving in the office. We're even having some patients wait in their car if necessary to make sure that we have people appropriately distanced in the office. Um, and also, at the door of several of the buildings that we're in, we're having screening of patients to make sure that everyone's healthy on the way in, and we have screening processes set up in each and every one of our offices to make sure that everyone's safe and there's as little exposure as possible. So that all brings us to telemedicine and our efforts again to be able to continue to care for people and at the same time keep people home and keep people safe. Uh, Telemedicine in some form has really been going on for a long time, not just these last several weeks, not even the last several years. Even if you don't think of it this way, almost everyone's probably participated in some form of telemedicine in the past. Because telemedicine really refers to any care provided by a physician or a provider from a remote circumstance instead of an in-person visit. This can be something as simple as a telephone call with your doctor to discuss your symptoms, to discuss a response to treatment, or to discuss the results of a test, an X-ray or an MRI. So most of us have done some form of telemedicine before. It's just that we're kind of taking that to the next level now to really be able to provide more thorough care and more thorough contact with your doctor without necessarily coming into the office or coming into a hospital type setting. And there's a few different kinds of telemedicine, as I kind of had alluded to. The one we're really here to talk about today is kind of what we call interactive medicine. And that's a real-time conversation, interaction with your doctor over a telephone, over a computer, over a cell phone. So you can do just about all the things you would do in a normal office visit in real time. But there are other types of medicine, as I mentioned, just a simple telephone call. There's remote monitoring, which might involve a heart monitor, a blood pressure monitor, a glucose monitor, in which you can kind of transmit health information to your doctor, either in real time or a recording of previous information, so your doctor can evaluate this and make health decisions based on information that he's gathered while not in the room with you. Another thing could be just taking a photo or a video or sending a test result to your doctor over a secure portal. And we do have a secure portal like that at Premier Orthopedics. It's called Health Jump. We have all the information about how to use that in our office. And it's another great way to connect to us without physically being in our presence or being in the office. I'm just going to mention right now, before we move any farther, that there is a comment bar, and I'm happy to answer any questions along the way. I'm going to try to answer them as I see them pop up, but I will definitely go back through at the end of our conversation to make sure I can try to answer that anybody has. Getting back to the telemedicine or virtual medicine visits, I first wanted to kind of talk about what kind of problems can be evaluated by telemedicine, because I think that's a big question on a lot of people's mind. And really, our goal is to take care of any orthopedic musculoskeletal issue over telemedicine right now. Just about anything we can take care of in the office, we can, at least to some extent, evaluate for you over telemedicine. Backaches, knee pain, shoulder pain, hip pain, foot pain, a post-operative evaluation if you've had recent surgery. We can do all these things over telemedicine. And even if you're a new patient, it doesn't, you don't necessarily have to have an established relationship with us. We can still evaluate you for the first time over a telemedicine visit. Of course, we always enjoy meeting new patients in person in the office, but right now we're trying to limit that and keep people as safe as possible and still kind of thoroughly evaluate them as best we can over these telemedicine or virtual visits. And that kind of leads to the question of, are we still doing office appointments? Can I still have an appointment in the office if I need it? And the answer is a resounding yes. We are still seeing patients in the office. We do realize that, many musculoskeletal conditions can't really fully be evaluated over telemedicine. And some of those types of visits might be, let's say, for instance, that you need a cortisone injection, or you need your cast or your splint adjusted or removed. To have stitches out after surgery. Obviously, these are things that we can't necessarily do electronically, and that we still need to do in the office. And our offices are very much open for that purpose. It's, I think, important for us to be doing that, important to stay open. Just because we have these stay-at-home orders and quarantine orders doesn't mean that your musculoskeletal issues are going away. So we're trying our best to keep up on all of those issues, regardless, and making sure that when you do come into the office, you are as safe as possible. And we can help you out with that. If you're somewhat unsure as to whether or not telemedicine is appropriate for you, we're happy to help you out and let you know if your appointment is appropriate for telemedicine, and we can easily kind of guide you with that. Along those lines, a lot of people are concerned, are there any types of appointments that are absolutely cannot be seen telemedicine? And I mean, I think the number is limited. I think 90% of visits we can do virtually over a computer or a cell phone type visit. But there are, of course, some things that can't be done that way and really shouldn't wait for kind of more urgent care. And those things are the types of things that you might otherwise go to the emergency room for, to urgent care. If you have a fall, if you have a more acute injury, severe pain, you're unable to walk, those are the things we're still going to want you to go to an urgent care, to the emergency room for. Of course, we don't want you to use the emergency room, in an inappropriate fashion or, kind of overzealous fashion when you don't absolutely need to, especially with everything that you can be exposed to right now. But, regardless, there are certainly some issues that should be evaluated in the emergency room. And we're happy to help you out with that too if you're a little bit unsure, if you want to give the office a quick call, if this isn't something that's kind of absolutely emergent. With that being said, I just wanted to take a little time to kind of describe what will happen during a telemed visit. Because again, this is something that a lot of people haven't experienced before, and they might be a little uncertain as to how it's going to go, want to know about the details of how a telemedicine visit works. And the first thing is that telemedicine visit, you will have a scheduled time, just like a regular in-person visit. We're trying to keep this as structured as possible so we can fit it into your life. We know even in these times you have other things to do, and we're going to schedule a visit and stay on time with that schedule. So you will have a time schedule, just like an in-person visit, and a few minutes before that scheduled visit, you're going to receive a link to click on. And that link might be either in a text message or an email, whatever you prefer, or sometimes we'll send it to both, so it's kind of whatever is easiest for you. And you're going to click on that link, and it's going to put you into a virtual waiting room. It's as simple as that. There's no app to download. You don't need to be any more technologically savvy than that. If you're in this live Facebook event right now, then you can certainly do our virtual visits, because it's honestly less complicated than getting into this Facebook event, and we've intentionally worked hard to make it that way. So you're not downloading a program, you're not downloading an app that makes this more confusing and is going to delay things more. So it's just clicking on a link. You're immediately going to be put into a video conference. It's going to be a virtual waiting room at first. And you should only be there for a minute or two, because once we send you that link, we're ready to talk to you. And once the first person that you're going to talk to after you get out of that virtual waiting room is likely going to be one of our staff members, whether it's one of our nurses, our medical assistants, or our athletic trainers, or a nurse practitioner. And they're going to go over some of the typical intake questions that you would normally do in our office. So, they're going to want to know if you have any new medications, about any changes in your medical history, surgical history, any recent visits to the doctor or to the emergency room. We're going to update that. That's just going to take a few minutes and make sure we're all on the same page there. And and they may also ask you, a few questions about your current condition, so they can fill the doctor in before the doctor comes into the room. Once you're ready, once all that is completed, that staff member is going to send an invitation to the doctor, and they're going to be able to click on a link and come into the room, and it's going to be a video conference where your doctor or your nurse practitioner can see you and you can see them, and you can talk just like this. We can hear everything, see everything, and kind of go over your office visit just like you would if you were in person. So the doctor's going to come in, ask you about your condition, ask you about any updates since last time, whether or not you've had any testing. If you've had any testing, whether it's an X-ray, an MRI, lab work, we're going to be able to look that up and fill you in on what the results are, and kind of what we think about that testing. So once that's done, we're going to be able to make an assessment, give you a diagnosis, and make recommendations. And those recommendations, what can they include? Right now, we are certainly happy to give you a home exercise program. Again, we want you to stay safe. We want you to stay home and be able to do some of these things on your own if that's appropriate. Physical therapy at times is appropriate right now. It may not be kind of used as much or as enthusiastically as it was just a few months ago. But for some people, that is the right answer right now. And of course, physical therapy locations are doing everything they can to keep people safe too, and I know that's happening in our premier locations. So we may give you a prescription for physical therapy if that's appropriate. You may need more testing, X-ray, MRI, lab work. We can send you a prescription for that, help you out with that. And even if you need, pain medications or another medication that is appropriate to treat your condition, we can do that electronically. We can send that right to your pharmacy so you can get the medication that you need. So that's kind of, in general, how the visit will go. And I think I wanted to bring together some special tips that to help you be a little bit more successful with your office visit or your telemedicine visit, and make sure that your primary focus during the visit is with talking to your doctor and going over your problem, and not kind of fiddling around with the technology or worrying about anything like that. So some of those tips that I have are, first of all, wear clothes that are appropriate for the office visit in terms of allowing your doctor to evaluate your problem. If you have a knee problem, put on a pair of shorts so that the doctor can, look directly at your knee, see, if there's any swelling, any redness, take a look at the range of motion. So you don't have to worry about that kind of getting in your way. If you have an elbow problem, same thing, wear a short sleeve shirt to make sure we can see, what we need to see and kind of thoroughly evaluate your problem. Because we're going to want to do that. We're going to want to, do as best physical exam as we can through the video conference. And that's one of the primary benefits of doing this over video conferences, because we can actually see. That's the big benefit over doing this kind of over the phone. Also, if you do have someone that you're comfortable, discussing your health information with, a family member, a friend, it might be helpful to have them there during the visit so they can hold the camera or their phone and kind of give the doctor a better perspective. If the doctor asks you to walk across the room, for instance, they can kind of take a better video or picture of that. So you're not trying to hold a phone yourself and, kind of show your range of motion, which oftentimes, doesn't work very well, or, can't kind of get a full perspective, kind of just hinders things. Again, I don't want you thinking about the technology when we're here. I want it to be just like we're having a conversation in person. So there's not this, third party there thinking about, what you need to do rather than just talking to your doctor about your problem. So having a family member or friend there can be very helpful in making this go smoothly. And really the biggest tip is don't be nervous, don't be anxious about this. We're ready to take care of you, to make sure that that this is a smooth process for you, that we're there to answer questions, walk you through the technology. We know that everyone's just getting up and running on this, and we've spent kind of countless hours getting this ready, getting this working, training ourselves, training our staff to make sure that it's smooth on our end so we can help you out on your end. And so you don't have to worry about that. So don't be nervous about it. Don't be anxious. We will make sure that it goes smoothly, that it goes well. That's what we're here for. So don't worry about, that part of the process. Just kind of looking at some of the questions that have been coming in. Christina is asking, are you screening scheduling to see if it can be done via telemedicine versus coming into the office? And absolutely, our phone staff have been thoroughly trained on that, and we continue to kind of update that process on a daily basis. The short answer is that most conditions can be taken care of via telemedicine, but our phone staff is well aware, which patients need to come into the office, and we're ready to tell you that. And the other part of it is, if we do initially schedule a telemedicine appointment and the doctor sees you and thinks that we need to bring you into the office or you need to do something else, then that's simple. We can do that. We can get you into the office as soon as possible. So that shouldn't be a concern. If you think that you'd like to have a telemedicine visit, tell our phone staff that. We're happy to get you in, and we can definitely, modify things if we need to. So that's something we can definitely help out with. Another kind of common question that we've had is, are these visits covered by insurance? Is there going to be a cost to me to do these visits? And the answer is definitely almost every insurance company is covering these visits right now. This has expanded rapidly over the last few weeks as both the government, as far in terms of state of emergency declarations, things like that, have released restrictions on any kind of telemedicine visits, and the insurance companies have done the same. All to help patients get the care that they need. So that shouldn't be a concern. These are charged very similar to a regular office visit. The insurance companies, the government have made sure that that's what's happening right now. So you're not getting unexpected charges, that's any different than seeing your doctor in the office. We want to, make you feel assured that you're not going to be paying out of pocket for these visits, other than the same thing you would do for a normal office visit, like your copay, which would still be applicable. But otherwise, insurance is definitely covering these visits, and our phone staff are also trained to make sure that that's the case, so you're not getting a surprise bill or anything like that. And yes, so that was a recent question. I'm happy to take any more questions at this time. I guess another common question that we've been been getting is, how do I know that my office visit is secure? And that's a very valid concern, because we know your health information is private. We do not want it, broadcasted anywhere. We don't want anyone else having access to it. And we've done everything in our power to make sure that we're using a completely secure portal, an encrypted, password protected portal on our end, so that your health information is completely safe and secure. And it is fully compliant with HIPAA, which are the government regulations, to make sure that health insurance is protected and private. This is not by any means a public site. It's not anything that anyone else could get into. The visits are not recorded. They're not stored anywhere. So your office visit is your own. It's between you and your doctor, your provider, and the staff member that's in the room. You will know everyone that's looking and listening. There's no one listening into these visits other than the people that you are directly aware of, which at the most at any time will be yourself and two people, the doctor and the staff member. Never anyone else, kind of other than that, in the virtual video conference with you. Waiting for any other questions that anyone else may have. Happy to answer. Another frequent question that we have been getting is that, are these telemedicine visits, something that we're only going to be doing during this current public health crisis, or is this something we plan to continue afterwards? Once the restrictions are relaxed, once we don't have to worry about going out in public anymore. And we very much plan to keep these telemedicine visits going. We've had a tremendous response, even in the first 2 or 3 weeks that we've been doing these visits. Patients are happy to be staying in their own home. They're happy that they can kind of do this from anywhere. We've had some patients doing them from their workplace on a lunch break or something like that. And I think we can really give people the care that they need, and even, first of all, keep them safe. Second of all, save them time in terms of their commute to the doctor's office. Some of our patients, of course, might have trouble with mobility, with getting a ride. All these things are improved by these telemedicine visits. So as long as we are allowed to do them, which we fully expect that we will be as time goes on, we do certainly plan on continuing these these virtual visits for the long term, not just over the next several weeks or months during this public health crisis. And I think we've had a very warm reception to that, and a lot of patients have been asking for that along the way. So we are planning on improving every day, making sure we're meeting your needs every day, kind of in the most modern way possible. Another question that we are getting on the live stream today is, how long does a telemedicine visit typically last? And that's a great question. The answer is quite variable. It is very similar to a visit in the office. You're going to spend that time initially in the visit with a staff member, and then with your doctor. And on the short end, I would say you might be spending 10 minutes in this video conference, and on the long end, you may spend 30 or 40 minutes, depending on the complexity of your problem, what treatments have been tried before, how difficult everything is to evaluate, what we might be recommending in terms of, an exercise program or testing down the road, and kind of what the complexity of that plan is going to be down the road. So that's something that, like your doctor's visit, could be a variable amount of time. But I think the good news is that we've definitely cut down on that waiting room time that you may have in your doctor's office, because it's just an unfortunate thing that happens in many doctor's offices, as I'm sure you know these days. Some days the doctor's running on schedule, and sometimes they're way behind. And the advantage of these visits is, if we are running just a little bit behind, which are doing our best not to be, at least you're sitting at home or sitting, doing something that you want to be doing, rather than kind of just stuck in our waiting room. looking at a magazine or scrolling through your phone. So I think you can be a little bit more productive in that time that you're waiting rather than waiting in our office. So I think that's definitely a good thing. And Chris, our great physical therapist, pointing out also in the chat is that we are working on a great solution for our physical therapist to use telehealth as well, which will be great. I think that's going to be really a game changer for us to be able to keep patients at home, for our physical therapists to be able to guide patients in their home exercise programs. I think it's both a great initial option for physical therapy. It's a great option at this time when everyone wants to stay home, and it could be a good transition kind of option from when you're fully in your doing your full formal physical therapy program to transitioning to a home program, to have that visit once or twice with physical therapy. We also have a question, is there any specific process for minors, children doing a telehealth visit? And the answer is very similar to what we would do for a regular office visit. If there is someone under 18 who needs a telehealth visit, we are happy to evaluate them. We just need a parent or guardian permission, and we would like them to be there for the whole time during the visit. So this is the one time that you absolutely need one other person other than the patient in that virtual video chat with us, other than just the patient. And so we are definitely happy to treat pediatric orthopedic patients just as we normally would, and we would want a parent or guardian's direct permission, again, just like we would in the office to treat that patient. And another comment from our chat, we do have maybe one dissatisfied patient with a telehealth visit, and that's unfortunate, especially if it was one of our visits. We apologize for that, and this is a work in progress, and we're happy to help you out, happy to do whatever we can to make sure that you are satisfied, that you're getting the care that you need. That's for sure. And like everything else, there's going to be growing pains, and we want to make sure that we're providing you absolute top-notch care, just like we would in the office. So anything we can do to help, we're happy to do it. And if telehealth doesn't meet that standard, and like I said before, we're happy to see you in the office at any time. Just scrolling through to make sure that I got to everyone's questions and comments at this point. We do appreciate everyone being here. See if there's anything else I have. A few people calling in otherwise. So I think we've addressed just about everything. Happy to have everyone here, and we're happy to see you in the office, see you on a telehealth visit, and happy to help you any way we can. So just call in. Like I said, our phone staff is specially trained to deal with everything that's going on right now. Any questions or concerns that you might have, we're happy to deal with them and point you in the right direction. And we want the most important things are yours. We want you to be able to stay home, stay safe, but continue your care. We know that your musculoskeletal issues are not taking a break just because the rest of the world is having this problem right now and having to stay at home. So we want you to be active. We want you to live your life and not have a musculoskeletal issue slowing you down at all. So we definitely appreciate you being here today. Again, I'm Dr. James Costanzo from Premier Orthopaedics, and from our Glen Mills, Aston, Wilmington, St. Francis, and media offices. We're happy to see you. Give us a call. Check us out on our website, premierortho.com. Let us know if there's anything you need or anything we can do that's better for you. Thanks for coming out today, and hope to see you soon. Stay home and stay safe. Thank you.